The references of Madatya we will get from this classical text. In Charaka Samhita, 24th chapter, Madatya Chikitsa, detailed on Madatya, and Susra Samhita Uttarasthana, this 47th chapter, Panatya Pradesheda Adhyaya, and in Ashtanga Hridaya, Nidana and Chikilsasthana. In Nidanasthana, 6th chapter, and in Chikilsasthana, 7th chapter. These are the references of Madatya available in Brihatrayi. What is Madatya? Madatya is caused by a Madakari Dravya. What is a Madakari Dravya? Madakari Dravya is Buddhim Lumpati Yat Dravyam. Madakari Taduchide. Whichever the drug which cause the which affect the buddhi or intellectual abilities, that is called as Madakari, which is Tamoguna Pradhana. Tamoguna Pradhana. Madakari Dravya will be dominated with Tamoguna because it increase or it aggravate the quality Tamoguna in the human being when it is consumed. The example for Madakari Dravya is Madhya itself. Major drug which is having the property of Madakari is Madhya. Madhya, another property is Amla Guna. These are the two properties of Madhya. Madhya is Sreshta among Amla Dravya. Madhya is Sreshta among Madakari Dravya. So these two qualities we should keep in mind while dealing with the chapter Madatya or dealing with the cases of Madatya. So whatever the Dravya which is affecting or which can influence the intellect or the brain functions, which is called as Madakari Dravya. That can be a positive or negative. In positive sense also Madakari Dravya can be used in treatment of psychiatric disorders and also for the enjoyment of life, etc. Madhakari Dravyas are useful. We will see the properties of Madhya and how it can be a beneficial one and how it can be a harmful one. So Madhya is not only a harmful thing. Madatya, when we discuss as a disease, it is harmful. For Madhya can be used as a medicine or as a treatment, especially in the previous era. Surgeries were performed using the Madhya instead of anesthetic agents. So Madhya can cause Mada, and Tamoguna will be increasing. The patient will not be aware of pain or patient will not feel or experience the pain. That kind of good qualities are possessed by Madhakari Dravya, and excitement, enjoyment of pleasure, and sexual energy, sexual vigor, increasing the sexual vigor, enjoying the sexual activities. Such kind of things are promoted or increased by the use of Madhya. So in the classics, especially in Ashtanga Hridaya, there is a detailed explanation or description about the positive effects of Madhya. Very detailedly, we will not discuss in this class because that may not be very useful in terms of exam or in terms of in the current scenario. So those who are interested, you can go through Ashtanga Hridaya and very detailedly Madhya Prasamsa. Madhya is compared with even with God. That kind of exaggerated explanations are given regarding the Madhya in Ashtanga Hridaya. While we looking into the Charaka Samhita, Acharya explains how to use Madhya in a proper way, how to use a proper way. So that is also having importance in the daily life, or those kind of Madhya are not the Madhya which is available here or in current scenario. This self-fermented the alcohols are mentioned in this classical text. Those Madhya are not much harmful. So that kind of Madhya, how depending on the Prakriti, Ashtanga Hridaya and Charaka also says depending on the Prakriti how we can use Madhya, which kind of Madhya is effective or useful in what type of Prakriti, and what is the effect of Madhya when it is taken by a Sattva Guna person. or what is the effect when it is taken by a Rajoguna dominated person or Tamoguna dominated person. So that kind of detailed explanations are available in our classical text, and which was the part of our custom. Madhya was the part of our custom. That is why that kind of explanations and are given for daily use of Madhya. Even though all these explanations are given, Acharya says if you are having buddhi or intellect, whether you will take Madhya. In the negative sense also he asked. If these kind of even this kind of positive effects are there for Madhya, but the seeing the negative impacts of Madhya, whether you will take the Madhya if you are having intellect or buddhi, that is also mentioned in the classic. So what we should understand is that Madhya is having good qualities. It can be used effectively in particular conditions, but it is not to be used in a regular practice, or it cannot be used as a free mind activity, as a free activity. It should not be taken as a routine or regular practice. It can be used in a particular circumstances or for a particular purpose. It can be used. That is what we can conclude by seeing these all these references. Okay, we can go through the disease. We will discuss on the disease aspect. Madatya as a disease aspect. Will not go in deep with the qualities of Madhya, or the benefits of Madhya, or how to use Madhya. What is the how to be a good uh, person, drinking person, like that. We will not go in detail, but we will discuss in detail about the disease Madatya. See Madhya, the properties of Madhya. Ashtanga Hridaya Nidanasthana starts with the properties of Madhya. Tekshnoshna Ruksha Sukshmamlam Vyavayi Ashugaram Lakhu Vikashi Vishadam Madhyam Ojaso Asmad Viparyaha. See, that's the very important thing. Tekshnoshna Ruksha Sukshmamlam Vyavayi Ashugaram Lakhu Vikashi Vishadam Madhyam. These are the properties of Madhya. Lakushna, Teshna, Sukshma, Vyavayi Ashugaram Amlam. These are the properties of Madhya, and this is very opposite to the ojas. This is very opposite to the properties of ojas. What we will understand from this, that is, the properties of madhya will oppose the properties of ojas. That is, if you take madhya, while you intake madhya, the qualities of ojas will decrease. That is why, that is what explained in the Madhati Nidana, Ashtanga Hridaya Madhati Nidana. In the beginning, Acharya says, Tekshnoshna Ruksha Sukshmamlam Vivai Ashwagaram Lagu Vigashi Visadam Madhyam Ojaso Asmad Viparya. Properties of ojas, opposite to the properties of ojas. Hence, if you intake Madhya, the property of ojas will reduce, or the ojas will reduce in our body. And see, another thing is explained here. Tekshna Ushna. These are the properties of Visha also. The same property, whatever mentioned in Madhya, that is similar with the properties of Visha, poison. Madhya and poison are having similar properties, or almost same properties, and which are opposite to the ojas. Then we may have a doubt whether if it is having a property similar to the visha or poison, poison will end up with death and madhya will not. What may be the reason? Acharya has given explanation for that also. Even though having the similar property, madhya and visha are having similar property, and which is opposite to the properties of ojas. Visha is having more potence. Vishedu Utkarsha Vrittidaha. In these qualities are embedded in Visha in a highly potent manner than the Madhya. That is why Visha will cause the death and Madhya will not cause the death when it is taken in a small quantity. Even Visha, even if you take in a small quantity, that can end up with a death. But Madhya is not like that. Those two are having the similar qualities, and those are having the qualities opposite to the ojas, but visha will cause the death and madhya will not cause the death. That is the importance. Visha having uh, high potent the potency of property is high in when it is embedded in the Visha. Vishedu Utkarsha Vrittidaha. That is why Visha caused the death and Madhya will not cause the death. So this is very important. Madhya and Visha are having similar property and Ojas is having opposite property. That is why Madhya will reduce the Ojas with this qualities, opposite qualities. We have to see the proper positive benefits of Madhya also. Rojanam, Deepanam, Hridyam, Swaravarna Prasadanam, Prenanam, Brahmanam, Velyam, Bhaya, Shoka, Sramabham. This very important and very positive qualities of Madhya. Rojanam, Deepanam, which is Agni Deepana, Rujikara. You might have seen some persons who are taking a small quantity of alcohol just before their food, usually before just before dinner and all. People are taking alcohol. Why they are taking? What is the benefit? What they experience the benefit? For those person, it is having a digestive property. Whatever the food they have taken will be digested. Agni Deepana is promoted by Madhya. Ruchi also having ruchi, giving ruchi taste to the food. Hridyam Swara Varna Prasadanam. Hridyam, very giving very happiness, pleasing effect. Swara Varna Prasadanam is also by the Madhya. Prenanam Brahmanam. Prenanam and Brahmana are the property. Brahmana, in the sense, it is very Deepana and Pajana. That is, whatever the food you intake, whatever the food you take, that will be get digested very easily and absorbed very easily into the body. Metabolism will be corrected. That hence this will lead to the having the properties of belly. It will give strength to the body. Okay. Then Bhaya Shoka Sramapaham. That is also another property and very important property. Bhaya Shoka Sramapaham. Those who are having some disturbed mind, Bhaya Shoka, etc., emotional disturbances, people are going to take Madhya or alcohol to relieve from that kind of stress and emotional imbalances. Those who are taking Madhya, that Madhakari Dravya Madhya is Madhakari Dravya, and that will affect the intellect, and Tamoguna will be increased in that person, and that Tamoguna will cover all or will subside or suppress all the other emotions like Bhaya, Shoka, etc. That will be subsided, and patient will go to a good sleep. Stramapaham, even tired with the heavy work, strenuous work, physical work. If you take Madhya, that will be relieved by the properties of Madhya. So heavy, strenuous workers and those who are having very difficult emotional problems, those who are suffering from emotional problems, that will be relieved by the use of Madhya. Even though having all these properties, you should not use the Madhya as for this purpose without any advice from the physician or a non-person, because that can be harmful in the later phases. Okay, why or how this Madhya is having this much benefits, that is explained here. Bahudravyam Bahugunam Bahukarmam Madatmagam. Bahudravyam Bahugunam Bahukarmam Madatmagam. These are the qualities very karma, bahuguna, bahukarma. Those properties will be more, qualities are more. Bahukarma madatmaga. Mada, this give a very good pleasing type of mada when it is used properly. Guner doshescha tad madhyam ubhayam cha upalabhyate. Good and bad things are available, are the good and bad things can be obtained from the use of madhya. If it is properly used, you will get the positive things or good things, and if it is used in not in a proper way, that will end up in with the some negative impacts. Vidhina matraya kale hideranne yadhabalam. It should be used in the proper vidhina matraya kale hideranne yadhabalam. This is very important. Vidhina, madhyakala vidhi, madhyapana vidhi, depending upon the strength of the person, depending upon the prakriti of the person, depending upon the situation of the person, then it should be selected. Madhya should be selected, and matraya, the quantity of madhya should be very much specified. Hitair anner yadha balam. Hitair anner, not should not take without having any food. The person should take food. Some if you see some alcoholics, they will be drinking from the morning till evening or till night. they will not take any food. Even though, as we said, as we discussed earlier, Rojanam, Debanam. But whatever Debana and Ruchya, Pajana properties are having uh, with the Madhya, some persons will take alcohol in large quantity and they will not feel appetite. They will not feel hunger. That much quantity should not be taken. In a small quantity, it is Depana, Pachana, Ruchikara. But in large quantity, it will not work like that, because in large quantity and chronic phases, it will cause Vada and thereby later stages Agni Mandya also will happen. Those persons will have very serious complications of Madatya. So proper diet, a very good quality proper diet should be maintained while having madhya. Yadha balam, according to the strength. Some people will having a good intoxication even by smelling the alcohol. Some people will not have any impact if they drink liters of alcohol. That difference are there. That range of difference should be noted. Where the person is standing, where what is the capacity of person, that should be noted, and that quantity only should be taken. Hideranir yadha balam. So prahishtoya pibet madhyam tasya syad amridam yada. So with the happiness, if you take this positively and all this maintaining all this uh, methods, vidhina matra etc., if you maintain, this is like amridam. Vidhina, if you use very properly uh, uh, according to the bala, according to the agni, according to the prakriti etc., this will act as amrita meda. Otherwise, the same, whatever the good qualities are there, that will be opposite. The patient will be affected, or the same, uh, the similar way, the qualities will be the opposite effect will be, adverse effects will be observed in the patient persons. So even though having the merits, the same way it will have the demerits also if it is not used properly within a matra, if it is not used within a matra, etc. Okay, these are the demerits of manada. If it is taken in not in a proper manner, not in a proper quantity or quality, or depending on the bala of person, the person will go into a different phase of mind. Dharma adharmam, sukha dukkham, artha anartham, hita hidam, yatha asakto na janadi, katham tat chilayed buddha. That is what I mentioned earlier. Katham tat chilayed buddha. If you're having a good intellect, whether you will take or not, katham tat chilayed, how can a intellectual person can take this? So dharma adharmam, sukham dukkham. The dharma adharma, ethics and unethics, sukha dukkha, artha anartha, hita ahita. These are the basic qualities, the basic differentiation qualities of a mind. Mind, if it is buddhi is proper, this differentiation should be happening in a person. This basic differentiation of qualities will be lost for asakta. Yadhasakto na janadi. That kind of person, those who are addicted to the alcohol, or those who are intoxicated with alcohol, with the madhya, that they will not be able, they will be unable to differentiate dharma dharma, sukha dukkha, artha anartha, hida hida, etc. So Acharya advice here, this should not be yadasakto na janadi kadham tat shilayed buddha. So it should not be, it's not advisable, it's not advised for taking. Then madhya moho bhaya shogo krodho mrityuscha samsrita. We mentioned earlier in the merits, bhaya shoga etc. will be vanished away with the proper use of madhya. If it is improper, all these things will be happening. All these things will be reaching to the person, attracting to the person. Madhya moho bhayam krodha mrityu etc. Even that mrityu is just samsara. All this will be happening. Not only these kind of diseases, all the diseases, including the mind, diseases of mind. So unmada mada murchaya sa basmara apadanaka. Spelling mistake is Abhadanaka. So these Unmada, Mada Murcha, Apasmara, Abhadanaka, etc. All these kind of Vada Vyadi, or psychosomatic disorders, or some psychological disorders can happen if you use the Madhya. These are mentioned as the demerits of Etrayas Nadi Vibramsa Tatra Sarvam Asadhyat. Ityevam Madhya Dosham cha Madhyam Grihandi Bhavada Yadanda. All these kind of effects will be happening with the use of Madhya. So you should not be the use of Madhya should not be promoted, because this can end up with these kind of diseases. Even though having all these adverse effects, if you are using properly in the right place in the right person, it will be beneficial. So that should be keep in mind. If whatever the positive qualities are there, the similar way negatives also there, and whatever the negative qualities are there, the same way if you use the in a proper way, it can be reversed. That we will discuss in later. Madhya itself is used as a treatment for Madhya. That is the quality of Madhya. That is the speciality of Madhya. So even though disease caused by Madhya can be treated with Madhya itself, that is the speciality of Madhya. And all those persons who are taking Madhya will not affect in the same way. You see, some person, if as I told, you should take for proper food while you are taking or consuming Madhya. If it is not, then it will cause adverse effect. So those who are having bala, that na adi madhyandi, intoxication will not happen in an abnormal way in such persons who are having strength. Balinaha kritahara mahashanaha. Kritahara, those who are taken food. After taking food, if you take some madhya, it will not affect adversely. Mahasana, those who are having taking good quantity of food. Snigdha sattva vayo yuktaha. Sattva-yukta and Vayo-yukta, having a good quality of mind, Sattva dominated quality of mind. Sattva dominated quality, if you have, will not go beyond the limits. The person will not drink beyond the limit. The person will be able to control the quantity of drinking. Sattva Vayo-yukta, Madhya Nitya, Tadanya, Madhya-yukta, Madhya Nitya. Those who are having Madhya Nitya, daily, the habituated to drinking will not also will not be affected. Some community or some families or some social customs are there. If it is there and using the madhya since childhood in a small quantity, and it is in a regular practice, that those persons will not be affected. Meda kabhadika, Meda kabha dominated persons will not uh, affect much with the adverse effects of Madhya, Medha Kabha, because these are opposite to the qualities of Madhya. Medha Kabha, qualities of Medhas and Kabha is opposite to the qualities of Madhya. Madhya is Vada Pitta dominant, and that will not cause much effect on Kabha, Medha, Diga persons. Manda Vada Pitta. That's what I told. Manda Vada Pitta. Vada Pitta, if in a person, if Vada Pitta is reduced, the person will not get affected with Madhya. If Vada Pitta is increased in a person, you are giving Madhya or they are taking Madhya, that Vada Pitta will aggravate or increase again, and that will again cause the adverse effects of Vada Pitta, or that will again aggravate Vada Pitta, and diseases of Vada Pitta will occur in that person. Dridha Agni, if it is proper. Agni is, if it is proper and Dridha, that kind of person will not get affected much with the Madatya. Why? Because Madhya, if it is digested properly and metabolized properly, that will not cause any harm to the body. Digested and metabolized properly. So that is why in a small quantity it will not harm anymore, because it will be get digested in the body and metabolized, and that will cause Devana, Pachana effect and Harsha, all this positive benefit. If you take more quantity, if Agni is not enough to digest or metabolize the uh, madhya, that will cause vidahitva. That we will discuss later in the samprapti. That will cause vidahitva, and that vidahitva is the cause of madatya. That vidahitva is the cause for all other symptoms followed by madatya. So that vidahitva can be avoided if patient is having good agni, or if patient is taking madhya depending on the uh, quantity of or the quality of agni he possesses. Okay, this is the these are all these are the principles related with madatya. We will discuss later, but towards those points, I'm leading you all this with this all references. So please note that all this, please note all these properties and qualities of Madhya. These are the treatment principles. These are leading to these are the guidance to the treatment principles of Madhya. Madhya is having Vada Pitta dominant quality, or Madhya will be increase Vada Pitta, and Kabha Meda opposite to the Kabha Meda, opposite to the Ojas. Okay, these are the causes. And Agni Deepana in small quantity, if it is if it is taken in large quantity beyond the quality or quantity of Agni, that will again cause Agni Madhya, and that will lead to Vidahitva. Improper digestion of Madhya, that will lead to Vidahitva. Again Pitta Vriddhi, and that will lead to complications of Madhya. This will be happening. We will see in the Samprapti also. In the Samprapti of Madhya. Madhyam Hridayamavisya Swagunai Rojaso Gunan Dasabhirdasa Samkshobhya Chedo Nairi Vikriyam. This is the Samprapti mentioned in Madhatya. This is the Samprapti mentioned for Madhatya. See Madhyam Hridayamavisya. Hridaya here mentioned is Chedo Adhishtana Hridaya. Chedo Adhishtana Hridaya is the sthana of Manas, as mentioned in Ashtanga Hridaya. Swagune Rojas Hridayamavishya Swagune Rojaso Gunan Desabir Desa Samkshobhya. Swagune with the properties of Madhya, which is opposite to the properties of Ojas, and that will harm, or that will affect on the 10 good qualities of Ojas, and that will counteract the properties of Ojas, and that will lead to the disease affecting the equilibrium of Manas. Chedana sthana, it is affecting the Chedana sthana, it is affecting the Ojas. So mind and body will be getting affected, and patient will be going to a state of Madhavastha. Madha, which is Madhya affects the Chedana sthana and body. Why? How it is affecting the Chedana sthana? Because it is having a Tamo Guna, and Tamo Guna will affect the Chedas, and this Ojo opposite to the qualities of Ojas, and that will affect the body in terms of or through the Ojas. So affecting the Ojas and affecting the Manas Chedana sthana. That is why this Madhya is causing impacts or effects on body and mind. Gauravam Lakhavad, Saityam Aushnyat Amla Swabhavadaha Madhuryam, Mardavam Taishnyat, Prasadana Ashubhavanat, Daukshyat Sneham Yavaitvat Stiradam, Sreshnadam Abhi Vigashitvat, Vaichilyam Vaisadyat, Sandradata, Saukshmyat Madhyam Nihandyevam Ojaso Sugune Gunan. That is what I mentioned just before. Opposite to the property. How Madhya is affecting the Ojas. These are the opposite qualities. Lakhu Guru Ushnam. Lakhutvat Gurutva of Ojas is affected. Ushnatvat Shedatva of Ojas is affected. Ishnatvat Mardava of Ojas is affected. Similarly, all this Desabir Desa Samkshobhya. This is the way Madhya acting on Ojas. That is why Ojas is reducing, and that is why the Bala strength is reducing in a person. So these are the 10 qualities of Madhya, which is affecting the 10 qualities of Ojas, and thereby Ojas is affecting, and thereby the strength is getting reduced, and patient will be going or ending up with any kind of diseases, especially dominated with Vada Pitta. Okay, so we can see the Samanya Lakshana. सामान्य लक्षणं तेषां प्रमोहो हृदयव्यथा विड्भेदः प्रतदं तृष्णा सौम्याग्नेयो ज्वरारुचि शिरपार्श्व अस्थिरुक्कम्बो मर्मभेद त्रिकग्रहं पुरोविबन्ध तिमिर कास्त श्वास प्रजाग्रह स्वेदो अधिमात्रं विष्टम्भः श्वयेदु चित्तविभ्रमं प्रलाभ चर्दिरुत्क्लेशो भ्रमो दुःस्वप्न दर्शनम. See, all kind of just from the beginning, so psychological symptoms, it will affect all the systems. See, all the systems are getting affected. All the dhatu or all the srodhas are getting affected with the intake of Madhya or Madhatya Samanya Lakshana. If you see, all these are affected. This can be seen. Swapna Dusswapna Darshana. Dusswapna Darshana is the seeing the bad dreams, and Brahma, Pralapa, all this Chitta Vibhrama. These are the psychological symptoms or impact of mind. Vidbheda is there, Vishtamba is there. See, all these two properties, opposite properties, you can see from the effect of Madhya. Some persons it can be Vidbhed and some person it can be Vishtamba or Vitsamba. Depending on the Prakriti or depending on the habit or depending on the nature of person, it may vary. Anyway, it will affect the digestion. From the beginning of digestive system, Brahma is depending on the ojas, last dhatu and ojas. They to the from the Rasadhatu till the ojas, it is getting it is showing impact. Astiruk, Parsha Astiruk, pain on the joints, pain on the bone, Kambha, Marma Bheda, Trikagraha, pain on different place of body. Uro Vibandha, Timira, Kasa, Swasa, Svedu Adimatra. See, all many of the Srodhas, most of the Srodhas are getting affected. And Madhya is showing or Madhya is showing symptoms on all these systems and in different way. So Madhya is a Dravya which is having all these properties opposite to the ojas, and this can affect all the systems of body in a very short time period of time. Vivahitva and Vikashitva are the property which help the Madhya to reach all these Srodhas, and this property can be used effectively in the treatment also. Whichever, if you want a drug to reach dhadus immediately, you can give along with Madhya, or you can give in the form of Madhya. That can be used. This property can be used effectively and positively. And while we are going to classification of Madatya or Avastha of Mada, Pradhama, Dvitiya and Tritiya, these are the three stages mentioned by Brihatrai. And in Madhavadana, 4 stages. Pradhama, Dvitiya, Tritiya and Chaturtha stages mentioned. See, both are same because those who are mentioning Pradhama, Dvitiya and Tritiya, those acharyas have mentioned a state in between Dvitiya and Tritiya. Dvitiya, Tritiya, your Madhye. One more stage is mentioned. The stage between second and third stage. So effectively, 4 stages are there, but classically mentioned in Brihatrayi 3 stages. Madhavadana mentioned as 4 stages only. See, how it's very easy to understand. This Pradhama, Dvitiya, Tritiya Mada are very easy to understand. Pradhama Mada means the first stage of intoxication. It is a very happy stage of intoxication. The positive effects of Madhya will be shown in that Pradhama Mada. While going to the Dvitiya Mada, it starts affecting the systems or it starts affecting the normal life of person, and it's starting affecting to the ojas and mental psychological activities, etc. In Dvitiya Tridiyo Madhya, that is third stage, according to Madhavanidhana, or the Sandhi of Dvitiya and Tridiya according to the other Acharya. That stage, this person will lose his normal consciousness. Intellectual abilities and normal consciousness will be lost. And Nirankusha, that patient, that person will be going without any control, without any self-control. And the last stage, Triya Mada, the completely losing the loss of energy, complete loss of the qualities of ojas and mind, and the patient will be down with like a coma stage. Ashtanga says, Ashtanga very clearly and very beautifully says, Nischeshtaha Shavavat Sede. Nischeshtaha Shavavat Sede. It's similar to the Shava. Nischeshta, no cheshta will be there, no activities will be there. That is the stage of Tridiya Mada. So beginning from Pradhama, we will see in each and every what are the lakshanas of each Mada. Pradhama in Praharshanam Predikaram. That happiness will be, he can enjoy the happiness. Happiness will be there. It start in this stage, Madhya starts harming the ojas or starts with the opposite qualities of affecting the qualities of ojas. It is starting, and he will be in a good excited stage, on elated stage. He will be there. He can enjoy the food and drinks. He can enjoy the activities, and the quality of his activities or abilities will be more sharpened. And those who are in the field of public speaking, teaching, etc., that abilities will be increased by the use of Madhya this stage. In this stage, the 10 qualities of ojas will be affecting in the beginning. Deshabir Desha Samkshobhya Chedo Nairi Vikriya. That is the first stage. Deshabir Desha Samkshobhya. 10 qualities will affect the Chedo Nairi Vikriya. That is our first mada. All properties will be then. That is a happy phase. Sukham Nidra will be there. All the Smriti will be, Buddhi will be sharpened, Smriti will be sharpened, and qualities of activities will be improved. So this is a positive stage, as I mentioned. It is a very good stage, and occasional drinkers with a small quantity drinking, not binge drinkers. Occasional drinkers means very small quantity and very occasionally. Those who are taking is called as occasional drinkers. Those who will be, those persons will be enjoying or experiencing this kind of mada, pradama mada, or those who are habituated with madhya, and those who are having or taking very small quantity of madhya can also enjoy this stage of mada. If person is not getting control over this stage, or this stage, the person will not stop taking alcohol, it will go to the dvidiya mada or madhyama mada. Dvidiya mada, actually it will affect the mind and intellect. It start affecting the mind and intellect. Dvidiye muhusmriti muhumoho vyakta avyakta vak muhu. The speech will be affected, smriti will be affected in an improper way. Loss of memory will be there, coordination of speech, thought will be affected, and even behavior also. Yukta yukta pralabascha. Pralapa will be there. That all kind of abnormal activities. Those we can observe that person as a drunkard. That kind of activities will be shown by the person in Dvidiya Mada. Okay. Dvidiya, Durvikalpa Hado Mudaha. Durvikalpa Hado Muda explained by Ashtanga. Durvikalpa Hado Muda is wrongful activities, and all intellectual thinking, judgment, all things will be affected, and that will be in a negative way. Judgment will be wrong. Wrong judgment, wrong activities will be done in the second stage. And so a patient person may experience sukha, but it will not be the real sukha or real happiness as we mentioned in the Prathama Mada. This is it's in a wrong way. Intellectual ability will be lost. So sukha, dukkha, etc. cannot be differentiated properly by this person. So Dvidiya Mada is the beginning of harmful stage. And with Madhyama Uttamayo Sandhi, that is in between Madhyama and Uttama, that is the third stage, according to Madhavadana, and in between Dvidiya and Tridiya Mada, Nirangusha Iva Vyalo, Nirangusha Iva Vyalo, without the control, the animal without any restraints. That how they will act, how that animal will act, that kind of activities will be shown by the persons in the Madhyama Uttamayo Sandhi, that is in between the stage of second and third. In this stage, especially Manasika Dosha, Rajas Tamas will be very much increased or elevated. In the first stage, Rajas Tamas will not elevate much. Rajas will be elevated in a good level to improve the activities, but will not increase up to a stage of disease. But this second, and between the stage of second and third, Rajas Tamas will be elevated and increased, and it will cause the diseases of Rajas and Tamas. This is the stage we can see observed in the Madhyama Uttamayo Sandhi. Then Tridiya is the last stage. That is, patient will go to look like a the person will look like a patient of coma. Inactivity will be there. Acharya Vagbhada in Ashtanga Hridaya says, Nischeshtaha Shavavat Chede Tridiyedu Madestidaha. Tridiya Mada Nischeshtaha. No activities will be there. Shavavat Chede will be like a Shava. There is no explanation is required other than more than this. Nischeshtaha Shavavat Chede. We will understand everything in these two words. Nischeshtaha Shavavat Chede. No activities, no consciousness will be there, cannot enjoy any pleasure, cannot be active, cannot respond to the activities, can't do any activities, can't experience sukha, dukkha, etc. Nothing will be there, completely lost. This is the Tridiya Mada. Okay. Tridiye shavavat nishcheshta shavavat chede tridiyedu madestitaha. That is Ishtangada. That two words are enough to explain this stage, and this reference from Charaka Samhita. And Madatya Madhyapana Vikara. Madhyapana Vikara mentioned by Susruta. 4 types of diseases mentioned by Susruta. 4 types of diseases mentioned by Susruta. Panatya, Paramada, Panajirna. Panatya, Paramada, Panajirna, Pana Vibhrama. Sorry, something happened with this. Panatya, Paramada, Panajirna, and Pana Vibhrama. This Panatya, Paramada, Panajirna, and Pana Vibhrama are 4 type of diseases. 4 type of diseases seen in or mentioned by Susruta Acharya due to the factor Madhya. Panatya are also 4 types. I will explain, and this is something with something wrong with the slides. I think it's automatically going. Panatya is 3 types. Vada, Pitta, sorry, 4 types. Pana, Vada, Pitta, Kapha, and Sannipada. 4 types Panatya is mentioned by Susruta. These 4 types are similar with the Madatya. 4 types of Madatya. Okay. All this Madatya, what we are going to see later, are explained under Panatya by Acharya Susruta. Then Paramada. Paramada is Anga Gurutva, Aruchi, Sleshmadikya, Shiro Guru. Kapha dominated stage of Madatya is called as, otherwise, that kind of disease is called as Paramada. In Paramada, Angamarda will be there, Aruchi will be there, Kapha, increased Kapha, Sleshma Adhikya will be there, Sandhi Bheda, joint pain will be there. Similar Lakshanas of Amavada you can see. Somewhat Lakshanas of Amavada you can see. That is Kapha dominated, Kapha Vadika Avastha. That is called as Paramada, which is caused by use of Madhya. The next third one is Panajirna. Panajirna is Ajirna of Madhya, which is not digested properly. Atmana, Vamadu will be there. Acid belching will be there. That is Amla Udgara will be there. Acid burn will be there. Heartburn will be there. Daha will be there. This Panajirna, Vidahitva of Madhya is occurring in Panajirna. The Madhya which is intaken is not properly digested, and that Madhya there inside the stomach will cause Vidahitva, and that Vidahitva is spreading all over the body, and that cause Atmana, Vamadu, etc. and other Lakshanas of Pitta. Amla Udgara will be there. Vidahita, Daha will be there. Burning sensation of digestive system will be there. All this will be seen in Panajirna. This is reference from Susruta Samhita Uttarasthana, Panatya Chikilsa. Then 4th disease. First one is Panatya, second one is Paramada, third one is Panajirna, and 4th one is Pana Vibhrama. Pana Vibhrama is having more dominated with the Pitta and Kapha will be there. Krideruk will be there. Vamathu will be there. Jwara will be Kantha Murcha, Kabhasravana, Shiroruk, Vidaha, etc. will be there in Pana Vibhrama. These 4 diseases are mentioned. These are exclusively mentioned in Susruta Samhita. All are diseases due to Madhya, and Panatya is similar with the Madatya mentioned in all other mentioned by all other acharyas. Paramada, Panajirna, Panavibhrama can be taken as some specific special diseases mentioned by Susruta Samhita. These are the Lakshanas of these diseases: Paramada, Panajirna, and Panavibhrama. This can be seen in patients who are habituated or who are having improper administration or taking improperly administering Madhya. Okay, next, some special conditions. Always very important, these 2 things, Dhamsaka and Vikshaya. See, Dhamsaka and Vikshaya occur due to either sudden stoppage of alcohol or sudden restart of alcohol intake. Some says Dhamsaka is due to some sudden stoppage and Vikshaya is due to sudden intake. That is, there is no such references anywhere. Dhamsaka, either Dhamsaka or Vikshaya can happen in persons, those who are suddenly stopping alcohol or they are suddenly starting with alcohol after a long break. That can be happening in these two diseases can be occur in any of this condition. If you stop the alcohol, the Dhamsaka or Vikshaya can be happen, or if you start alcohol, Dhamsaka or Vikshaya can be happen. These are two diseases with two different group of lakshanas. Dhamsaka is having Dhamsaki Sleshma Nishtiva Kantha Shosho Adinidrada Sadda Sahatvam Tandraja. If you observe these symptoms, these lakshanas in a person of Madatya, this can be termed as Dhamsaka. You have to take the history of patient, whether he started suddenly or he stopped suddenly. And then if you observe these lakshanas, Dhamsake, Sleshma Nishtiva Kanda Shoshwadi Nidrida Shabdahatvam Asahatvam Tandra, then it can be diagnosed as Dhamsaka. Vikshaye Anga Shiro Atiru. Hritkanda Rogo, Samoha, Kasa, Krishna, Vamijura. If these symptoms are seen, you can term it, you can denote it as Vikshaya. Madatya Chikitsa, then we'll go to the treatment of Madatya. Madatya Chikitsa Sutra. Yam dosham adhikam pasye tasyado pradikareet kabhasthananupurvya va tulya doshe Madatye. Vitta maruta paryandam prayena tu Madatya. Very, very important context, very important area of Madatya Chikitsa. All other following Chikitsa treatment methods you can very easily understand if you understand this principle. Yam dosham adhikam pasye tasya ado pradikaret. Actually, Madatya is a tridoshaja vyadi. All the three doshas will be affected. How these three doshas are affected? How this actually we have seen that Madhya is having the properties of or increasing the properties of Vata and Pitta, and it decreases the Kabha. It decreases the Kabha. Then how these three doshas are affecting? That will be a doubt, common doubt. Generally, we will feel the doubt. How it can be tridosha? And kabhasthananupurvi chikitsa is mentioned if tulya dosha. If three doshas are equal and these three doshas are equal, kabhanupurvi chikitsa, that treat the kabha first. Why? This is seen in this should be understood from the samprapti. See, Madatya happening or starting from which place, which sthana? It is from Amasya. It is from Amasya. Amasya is Kabasthana. In Kabasthana, as I mentioned earlier, in Kabasthana, if you are giving a proper quantity of Madhya, depending on the Agni, that Madhya will get digested and it will not harm the person. See, if it is not in a proper way or not in a proper quantity, what will happen? That in the Amasya itself, the dosha, it will start the abnormal doshas will be starting producing. So Vidahita will be there. There, which dosha will be affected? Kabha dosha will be affected. So Sthanika dosha is Kabha, where the Samprapti starts. Where the Samprapti starts, Sthanika dosha is Kabha. Same what we can see in Jwara Chikitsa also. In Jwara also, Sthana is Amasya. In the beginning, it is starting with Amasya. Even though dosha is Paitiga, Roga, disease is Pitta Pradhana, it starts in the Amasya, that's why we start with Langana. Same way here, it starts in Amasya, even though disease is Vada Pitta Pradhana, it starts in Amasya, so we'll start treatment for Kapha dosha, Sthanika dosha. If dominated, all the three doshas are equally seen. Otherwise, that is, if Pitta is dominated, you treat Pitta first. If Vata is dominated, you treat Vata first. In Madatya Samprapti, from the beginning, Amasya, it will affect, as I mentioned, it will affect all the Dhatu and all Srodhas. It's having Vyavahita and Vikashita, it affects all the Srodhas. So, which is dominantly affected, or which dosha is dominated in the Samprapti, that should be identified depending on the symptoms. Then you should treat for that dosha. If it is not identified or if unable to identify all these three shows equally important, you start from the Amasya. That is, you start from the Kapha. Pitta Maruta Paryandam Prayena to Madatyam. Pitta Maruta Paryandam. Later it will be Pitta Maruta Paryanda because once it is the role of Amasya is over, Pitta Maruta dominated is Pitta Maruta. So then we can go for the treatment of Pitta Vata. Okay. Hope you understood. That is dosha. Disease wise dosha is Pitta Vata. And starting from beginning from the Amasya, the Sthanika dosha is Kabha. So three doshas are involved, and three doshas, if you see in the norm or in a equal importance, in equal role, you start treatment with the Kapha dosha. If it is not in equal role, whatever the dosha dominated, identify the dominated dosha, identify the dominated samprapti, whatever srodharodha, whatever it is happening, treat for that first. Later on, you go for samanya chikitsa madatya. Okay, this is the treatment principle, very important and should be understood very clearly. Then why madhya? Then next is madhya, use of madhya in madatya. Very important medicine, very effective medicine in madatya is madhya. Hina mithya adiyogena yo vyadhirupajayate samapidena teneva madhyena upashamyati. This is developed by inadequate and improper or excessive use of madhya will be relieved by the proper use of madhya. How? That is explained here. That will be explained. This is what we can see. Tikshna Ushnaina Adimatrena Pidena Amla Vidahina Madhya Anna Rasakledo Vidakta Sharadam Gadaha. See, this Madhya, when it is not digested properly from the Amasya, it will cause Vidahitva, Vidaktaha Ksharadam Gadaha. This Vidakta Avastha will lead to Sharatva. Improperly digested Madhya will achieve the quality of Kshara. Amla, Rasa, Kleda in Vidakta Avastha. Madhya is having the properties of this all Tishnushna Vidahito. Why? All this, if it is not in the Amasya, if it is not digested properly, even either because of reduced Agni or because of increased use of Madhya, this will be causing the Ksharatva, Vidahitva. Improperly digested Madhya will be attaining the properties of Ksharatva. This Ksharatva is causing all other symptoms of Madatya in the body. So, how can you neutralize Kshara? Kshara can be neutralized by the use of Amla. Kshara can be neutralized by the use of Amla. And what is the best Dravya among Amla Rasa? That is Madhya. So Amla is the best among, Madhya is best among Amla Rasa Dravya. That Madhya is using here when it is achieved Kshara Guna. Madhya, inside the body, Madhya is having Kshara Guna. That stage only, in that stage only, Madhya is effective, and in that stage, Madhya is the best, or Madhya is very effective in that stage. So, if it is Ksharatva is there in the body due to the improper digestion of Madhya. Amlat Vidaktha Ksharadam, that type, that, and in that condition, Madhya should be given, and that Madhya will neutralize the Kshara, and with the combination of Kshara and Amla, that will go, that will convert as Madhura Rasa. Kshara and Amla in combination will form as Madhura Rasa, and that is not harmful. Kshara is harmful to the body, and Madhura is not harmful. Madhura is Satmya. Human body is Madhura Satmya. So Satmya Rasa, it will convert Ksharatva into a Satmya Rasa. And Srodhorodha, this Tishna, Ushna, Vyavahi Guna is there, that will remove the Srodhorodha. And the Srodhorodha, how it happened? That Srodhorodha is happened due to the Ksharatva, or that due to the Vidahitva, or due to the improperly digested Rasa, Ahara Rasa, that caused Srodhorodha. Even if the qualities of Medas is there, Kabha is there, whatever the Kabha or Medas Kledatva can cause Srodhorodha. So Madhya with its properties reduce this Kledattva, reduce the Kapha, reduce the Vidaktavastha, and improve the channel circulation of channels, reduce the Srodharodha, remove the Srodharodha and improve the circulation, and thereby treat the Madatya. Charohi Adi Madhuryam, Shikram Amropa Samhita. That's what I told. Chara will convert it into the Madhura Rasa if it is associated with Amla Rasa. Madhyam Amleshu Sreshtam. Madhya is Sreshta among Amla Rasa Drivya. Dosha Vishindana Dosha Samanatva. Tikshnoshna Pura Prokta Devanadi Tada Gunehi Satmitvacha Tadevasya Dhadu Satmikaram Param. Satmitva. That is another important thing. For Madatya Rogi, Madhya is Satmya. For a Madatya patient, Madhya is Satmya. Dhadu Satmikaram Param. So, quality also can be utilized, effectively utilized in the treatment of Madatya. Okay. Then we will see some treatment of disease, Madatya depending on the dosha. It's not much important, but this is what we can see. Pishta Madhya, in Vadika Madatya, Pishta Madhya, Raga, Shadava, etc. are to be used. Fumigation and external therapies are advised. Sorry, with some technical mistake, technical error with the slides. Pishta Madhya, Raga, Shadava, Mamsa, etc. are used. In Madhika Madatya, fumigation and external therapies, Harshana, Alingana, etc. are mentioned. Etc. are mentioned in Vadhika Madatya Chikitsa. I will provide all these notes, including all these dosha-based treatments. You can go through that notes. In Paitika Madatya, Madhya should be used in Bahujala. It should be used with more quantity. Madhya should be used with mixed with more quantity of water. And Sharkara Madhya is mentioned in Paitika Madatya Chikitsa. Pishtakrita Madhya is mentioned in Vadika Madatya Chikitsa. Sharkara Madhya is mentioned in Paitika Madatya Chikitsa. And it should be added with more quantity of madhu or more quantity of water should be used. And Dadima, Kharjura, etc. Pitta Shamana, Sita Dravya, Madhura Rasa Pradhana Dravya are used in Paitika Madatya Chikitsa. Panaka prepared with Madhura Rasa Dravya. Panaka prepared with Madhura Rasa Dravya also mentioned as the treatment of Paitika Madatya. And soup of Aja, Shasha, etc. Soup of Aja, Shasha, etc. are advised in Paitika Madatya Chikitsa. It should be administered in as cold. It should be administered. So these are the treatment mentioned in Paitika Madatya. While moving to the Madatya, Kabhaja Madatya Chikitsa, this is very common, as you know. Vamana will be the Chikitsa for Kabhaja Madatya. Amasya is the sthana of Kabha. As I mentioned, Amasya sthana, Kabha dosha is there. Directly you can go for Vamana. Vamana will be there. Upavasa, Lankhana can be, Upavasa can be done. And Kabha Shamana Aushadha can be used. Shundi, Stira, etc. Kabha Shamana Aushadha can be used in the treatment of Kabhaja Madatya. And Kabha Pittaja, if it is Kabha Pittaja, Kabha Paitika, there also Vamana is mentioned, and Draksha Rasa, Ikshu Rasa are mentioned even as Shamana and also for Vamana. Draksha Rasa, Ikshu Rasa can be used in large quantity to induce Vamana. So Kabha Pittaja Madatya, you can go for Vamana, and that Vamana can be done even with the Draksha Rasa, Ikshu Rasa, etc. Then the special conditions what we have seen, Dhamsaga and Vikshaya. Dhamsaga and Vikshaya are dominated with Vada predominant diseases. So Vadika Madatya Chikitsa, what are mentioned in Vadika Madatya Chikitsa can be performed. And main treatment, one of the main treatment mentioned for Dhamsaga and Vikshaya are Vasti. Vasti treatment is mentioned in Dhamsaga Vikshaya. Then all Sneha Prayoga, Tarpana Prayoga can be used. Ghrida, Kshira can be used internally. Abhyanga, external therapy, Snehana Dravya with external therapies with Snehana Dravya can be used in the treatment of Dhamsaga and Vikshaya. Then another important context you can see the slide is Kshira Prayoga and Madatya. See, these two are the very important context of Madatya Chikitsa. One is Madhya Prayoga and another one is Kshira Prayoga. Other than the basic treatment principle, other than the basic treatment principles, these 2 points are very important. Why we should use the Kshira in the treatment of Madatya? संशुद्धि शमनाद्येषु मददोष कृतेषु अपि न चेत् साम्येत् कफे क्षीणे जाते दौर्बल्य लाघवे तस्य मध्य विदग्धस्य वादपित्त अधिकस्य च ग्रीष्मोपतप्तस्य तरो यथा वर्ष तथा पया. See the importance of Shira. You might have seen this similar principle or similar benefits you might have seen in the Jwara Chikitsa also. What we do in Jwara Chikitsa? Jwara Chikitsa we use Lankana. We use the treatment principle. The main treatment principle is Lankana, and after Lankana we start giving Aushadha Prayoga, Aushadha which is Pitta Shamana and Devana Pajana. Jwara itself is a disease with a Pitta dominant condition, Pitta domination, and Lankana and the quality of Jwara will be causing the Dhadukshaya in a person. Similarly, the fire happening in the forest, all these trees will be burned out, and after that burning, after that fire, if rain comes, this new plants will be there. You can observe new plants in the forest. That is the similar way. That simile is used there in Jwara Chikitsa also. Here also, Grishma Upataptasya Taror Yadha. Grishma Upataptasya. Because of Grishma, Taror Yadha, that plants and trees are getting weak or getting dried up. And Yadha Vashtam Tadha Paya. There, if you see, or that trees or that plants are getting rain, how they will nourish, how they will get again as a second life or re-life. Similar way, pious in the Madatya Rogi. Same in the Jwara Chikitsa also. Same in the Jwara Chikitsa also. Samshuddhi Samanadeshu. Madadosha Kradeshu. Whatever especially the qualities of Madhya. Vada Pitta increasing qualities of Madhya. Mada Dosha Krida. And what the treatment we use, Samshuddhi Samanadi Chikitsa we use, Vamana, Vasti, etc. Kabakshine Jade Daurbali Lakhave. Kabakshine. Shina Kapha will be observed in that patient due to the treatment and due to the property of disease. Daurbali Lakhave. Daurbali, Durbalada and Lakhava will be there. Lakhutva will be there. Tasya Madhya Vidaktasya Vada Pitta Adhigasya. Vada Pitta will be dominant. We have seen in Pitta Maruda Paryandam Prayanadu Madatya. Pitta Maruda Vada Pitta dominated condition is Madatya. That patient in the later stage will be Vada Pitta dominated condition, and Lakhutva will be there. Kapha will be in Shinavastha, Bala will be in Shinavastha, Daurbalya will be there in that person. In that condition, you can give Kshira that will be nourishing the dhadu and body, like rain nourishes the tree after Grishma or after a summer season. So this is the Madhya Kshinasya Kshinam Kshiram Asveva Pushyadi. Madhya Kshinasya Kshinam. The Kshina of Madhya Kshina, tiredness or weakness of Madhya Kshina will be relieved with the Kshira very fast. Kshiram Asveva Pushyadi. Ojas Tulya Gunai Sarve Viparidam Cha Madhyadaha. See, from the beginning we have seen, I told there, it's very important you understand those principles. Same way, what is here we use Madhya are having opposite qualities of Ojas, and Dashabhir Dasha Samkshobhya. Madhya is affecting all these 10 qualities of Ojas, and opposite to the Ojas, and Madhya is causing these diseases. And what we are using here, Kshira. Kshira, what is the properties of Kshira? Kshira is having the similar properties of Ojas. Oja Tulya Gunaihi Sarve Viparitam Cha Madhyada. Oja Tulya Guna is equal to Viparita of Madhya. Opposite to the Madhya and similar to the Ojas. That is Kshira. That is why or there. Hence, this is Kshira is having such importance in the treatment of Madatya. See, not in all conditions, Shira is effective. In the previous treatment modality, we have seen that Ksharatva is there. For Ksharatva, in that Vidakta Avastha and Ksharatva is there. If you use Shira, what will happen? That Vidakta Avastha will increase. That Agni is not there and it cannot digest the Kshira, and again this Charatva will increase and disease will aggravate. So in that condition, Madhya is the best. But see, in this condition, if you use Madhya, what will happen? Vada Pittadhigasya and Kabha Manda is there. Vada Pittadhiga and Kabha Manda. What will happen? Madhya will again aggravate, increase the Vada and Pitta and reduce the or alleviate the Kabha. Again, Bala strength will be reduced and again the disease will be progressing. So, depending on the stage of Madatya, these two can be very effectively used. If it is not properly used, both these things will harm the patient. So very should be very careful in diagnosing and very careful in deciding the treatments. These are the some important formulations mentioned in different classics. Trishna Harakola Dadima Vikshamla Chukrika Chukrikarasa Panchamlo Mukhaleba Sadhya Trishna Nestari. In Vada Pitta dominated, Madatya is Vada Pitta dominated. Vada Pitta domination is can cause the Trishna. Especially in Madatya patient, Trishna will be there. That Trishna Mukhaleba is Kola Dadima Vikshamla. Amla Rasa predominated Dravyas are mentioned, that can be used as Mukhaleba. Trishna Niyachadi. This can reduce the Trishna. Another, this is very important, Yoga Ashtanga Lavana. For exams, it's very important. And in clinical practice also, it can be very effectively used. Ashtanga Lavana can be, this should be studied for exam purpose. However, Chilaja Jija, Vikshamlam, Samla Vedasam, Swagela, Marija, Arthamshi, Shakara, Bhaga Yojitam. Edat Lavanam Ashtangam Agni Sandebanam Param. Agni Sandebanam Param. Madate Kapha Praye Dadya Srodo Vishodana. Srodo Shodana and Agni Debana are the major need in Madate Chikitsa that we can use, that we can achieve by the use of Ashtanga Lavana. So many other yogas are there. Kavita Panaga, Drakshadi Panaga. Drakshadi Panaga is mentioned in Sahasra Yoga, Guluji Bhadra Mustadi, that is mentioned in Charaka and Ashtanga. When the Madatya patient is having Kasta, Rektanishtiva, Parshva, Stanaruja, chest pain, Parshva, Ruja, pain on flanks, Rektanishtiva, etc. There, Guluji Bhadra Mustadi in the form of Kashaya is advised. Draksha Rasa, Chaga Mamsa Rasa are mentioned if it is Trishna or aggravated Vada Pitta is there, it is mentioned. This Chaga Mamsarasa or Draksha Rasa is mentioned. Different prayogas of Madhura Rasa, Amla Rasa, Dravyas are mentioned in Madatya Chikitsa. It should be used. Those principles what I have mentioned previously should be kept in mind and you can use. Where to use Madhura, where to use, whatever the condition, what we have seen Kshira Prayoga, that condition you can use Madhura Rasa. Which are the conditions which is indicated for Madhya Prayoga, that there you can use Amla Rasa Prayoga. This kind of modifications you can make and you can use, and also depending on the dosha, different formulations can be used in Sahasra Yoga, Ashtanga Hridaya, and Charaka, different yogas are a few are mentioned here. And one more thing, what we have to see is there will be deficiencies in Madatya. There will be deficiencies in modern alcoholism also. First, the line of treatment when the patient is admitted with intoxication, first line of treatment is supplementation. They will supplement vitamin, especially thiamine supplement will be there. This deficiency will be seen in that patient, and intoxication symptoms will be reduced when you supplement this vitamins, especially thiamine. So, Kabita Panaga, Drakshadi Panaga, etc., have the property or the ability to supply this kind of vitamins. That is, Tarpana effect will be there. So, Dadima, Kharjura, Draksha, Kabita, etc., are having Tarpana effect, and that is very effective. Even a similar way as you give IV fluid, that kind of action you will achieve by using this type of panaka, provided he can take orally. If he is unable to take orally, IV are required, or parental route should be, administration should be at the choice. Otherwise, if you are able to supply all these kind of drugs, this will be very effective in managing the Madatya, especially in the stage of especially the in the stage of intoxication. We'll move on to the topic alcoholism. Madatya, the second part is modern alcoholism. Alcohol is the neurocerebral inebriant. Inebriant means intoxicating type of poison. Is this available in two forms, methyl alcohol and ethyl alcohol? All of you know, methyl alcohol is poisonous drug, poisonous form of alcohol, and ethyl alcohol is edible or consumable form of alcohol. Ethyl is very pure, transparent, having a spirit, odor, and burning taste. This should be important if you understand these things while treatment. That is absorption. 20% of absorption is in stomach, and 80% of absorption is in the small intestine. See, you just think about the samprapti we have seen previously and what the treatment we have given, etc. This that can be connected with this, and that can be established by using this knowledge also. Metabolism 90% in liver and 10% is excreted through skin. 90% of liver. So liver toxicity will be more in alcoholic persons. Liver is having more workload while metabolizing the alcohol, not from the digestive system. Absorbed into skeletal system and adipose tissue in the later stages. That's what we have seen previously. It affects all srodhas and all dhadus. Asti, Shula also was mentioned in the Samanya election of Madatya. That kind of absorption and that kind of effects you can see. These are some few words regarding the alcoholism. Social drinkers, heavy drinkers, binge drinkers, alcohol abusers, dependent or addicted drinkers. Social drinkers very occasionally, not very frequently. Heavy drinkers means regularly drinking. That is also differentiated on gender wise. Men more than 7 times in men and more than 5 units per day in female can consider as heavy drinker. Binge drinking is very dangerous thing, very dangerous among this alcoholic, because we cannot predict when they are drinking or how much quantity they will drink. They will not take regularly. Very occasionally they may drink, but that occasionally means very heavily. If they drink, they will drink very heavily. If not using, they will not use at all. So that binge drinking is very dangerous. Alcohol abusers or problem drinkers, the drinking causes social problems. Those who are drinking and harming or causing harm to the society and surrounding people, that is called as alcohol abusers. Those will be treated legally and medically. Dependents or addicted drinkers, alcoholics, then the subjective awareness of compulsion to drink, very addicted. They will be having the craving towards alcohol. They need alcohol. They will drink. Seeking behavior, or they may do anything to get alcohol to drink. If they don't have money, they will do anything to get money and anything to achieve alcohol, the sufficient quantities they require. That's also problematic persons. Alcoholic ketoacidosis, alcohol use disorders, alcohol dependence, alcohol addiction. This, depending on the system affected, these diseases will be happening. A chronic disease characterized by uncontrolled drinking or preoccupation with alcohol, inability to control drinking due to physical and emotional dependence. These all things can be seen in an alcoholic. See the symptoms in general. Body, related with body, blackout, dizziness, shakiness, craving, sweating, etc. will be seen. In behavioral, aggression will be there, agitation can be seen, compulsion, self destructive activities will be there. or agitation means they can be problematic to the family, they can be problematic to the society, they can be problematic to the self. These persons will not uh, attain their own duties, even in their profession or in their family life or in their social life. They will not be able to perform their own duties, and they will be incapable of their activities, and they will become a nuisance to the society, family, and professional. All these things. These are the problems with alcohol. That's what we have seen in the Madhya Kadam that Chile Buddha Ythasakto and Janari Dharma Dharmam Sukha Dukkam etc. will not be achieved or attained by or discriminated by those persons, and that person will be behavior that person will be showing behavior like this aggression, agitation, etc. Then that will be a nuisance to the society and family, etc. Mood will be their anxiety, loneliness feeling, depressive feeling, or anxiety feeling. Their elated will be there, euphoria will be there, and GA related things, nausea, vomiting. We have seen in Ayurvedic part also, Vishtambam, Vedbedam, Adhisara, etc. All Aruji, all that kind of digestive symptoms will be there because of non-absorption or non-metabolizing the alcohol. Psychological symptoms, delirium, fear, krodha, shoga, etc. We have seen all those things only here. There is nothing much to explain, nothing much to say here. Problems with coordination, slurred speech, tremor, etc. Vadiga Lakshana will be other type of Lakshana will be there. These all symptoms, whatever we have seen in Samanya Lakshana Madhati and other Lakshanas, whatever we have seen are explained here. These are three stages of excitement, incoordination, and coma. They have seen three phases of Madatya. Stages of excitement, euphoric, this elated mood will be there, very happy and speech and emotions, increased confidence will be there, for, and concentration will be less slow. In the beginning, it will be positive, and in the later stages, it will be less low. Self control will be losing in the last of first stage of excitement. Judgment and memory will be first thing, it will be sharp, and later it will be affected. And stage of incoordination, in the this stage of incoordination can be similar to the stage between second and third, madhyama uttamayo sandhi, that can be seen as the stage of incoordination. Incoordination of fine and skilled movement, unable to walk properly and unable to speak, and vomiting will be there. Some smell of alcohol, people, dilated people, and physical symptoms will be, it can be observed in this stage. Stage of coma, Mr. I mentioned the speech. That last stage, that's very difficult to do activities and all these things. Speech maybe there, if it is there, very slurred and unclear. Giddiness will be there, falling rapid pulse, hypothermia can be seen, the contracted people can be seen. All this can be seen in the third stage or coma stage. This is alcoholic intoxication. See, three stages actually in alcohol or any substance abuse. We can see mainly as three. One is intoxication. Second one is withdrawal. Third one is dependence or addiction. These three things should be understood and addressed. First is intoxication. Intoxication means patient or person has taken that madagari dravya or whatever the substance, abuse substance, especially alcohol, and those symptoms of that will be seen. Symptoms that these three stages of mada we have seen, three stages of alcohol intoxication we have seen previously. Those type of lakshana symptoms will be there in the intoxication. For intoxication, detoxification should be the treatment. That is the first stage or whatever, and different, that a kind of stage we can, or stage we can see in the alcoholic. Those, emotional loss of emotional restraint, feeling warmth, flushing of skin, 50 ml. This quantity wise it is mentioned, but it may vary person to person. In general it is mentioned. These are the quantity ways. What are the symptoms? Or 500 mg per dl can be cause for the death, lowering of BP. These kind of things can be seen depending on the
or based on the quantity. Then alcohol withdrawal. Actually, withdrawal symptoms in alcohol withdrawal symptoms can be seen within 7 days or 3 to 4 days. It will start and it will it will last for 15 days, maximum 15 days. Some cases it can be seen beyond 15 days, up to 30 or 40 days. It can be seen very rarely. Withdrawal symptoms. What are the withdrawal symptoms? Withdrawal symptoms mean the person that can be seen as we have seen Dhamsaka Vikshaya. Patient will show any kind of psychological and neuropsychiatric symptoms can be observed in a patient because of dependence of alcohol by the body. Body is taking for alcohol, and it is not available in the bloodstreams, and the symptoms will be occurring. Disorientation, confusion, anxiety, tremor, tachycardia, etc. will be seen. Anxiety can be the nausea, vomiting. This withdrawal should be managed in the hospital. If it is withdrawal is managing in the home or patient is very free, the person will go to take alcohol and to relieve the symptoms. This withdrawal stage can be treated with maintenance therapy also. We can, whatever the drug he is using, especially, it can, if it is alcohol, that can be maintained. That is what we have seen in our classics. Madatya, Chara properties is there, Madhya is giving in a large quantity, mixed with a large quantity of water. Vadhiga Madatya and Paitiga Madatya Chikilsa, we have seen giving Madhya giving Madhya with a large quantity of water, Ikshurasa, Madhu, etc. So that kind of maintenance therapy can be done to relieve withdrawal symptoms. Adishta preparations also can be given in Ayurveda. Sigandas or Adishta preparations can be given to replace the Madhya. So withdrawal symptoms can be managed by symptomatic management or maintenance therapy. Maintenance therapy is whatever the drug abuse, that drug will be maintained, or similar quality drug will be maintained till the withdrawal symptoms subside. Blood alcohol concentration will be checked, and treatment. It is not as absorbed gastric lavage. Neutralizing agents can be de-addiction therapy. These are used in case of withdrawal and intoxication, depending on the condition of patient. See, another thing is addiction. Addiction is craving towards alcohol. That even after managing the withdrawal symptoms, the patient will go out of hospital, and the patient is unable to control taking alcohol. The addiction will be there. That addiction should be managed with the proper psychotherapy. It should be managed with the proper treatment, psychotherapies, de-addiction therapy, rehabilitation awareness program. It is in Ayurveda, it's very effective at removing the addiction or treating the addiction are very effective in Ayurveda. Acute intoxications may be very effective by modern management. Withdrawal also can be. Both systems are both systems are effective. And if you parenteral load administration is required, you can go with the modern medications, thiamine supplement, etc. Can be. Wernicke-Korsakoff psychosis is a condition with the thiamine deficiency, or in alcoholics, there is a condition called psychosis. There is Wernicke-Korsakoff psychosis. It's a psychotic condition. Patient will be observed or seen as uh, as a psychotic patient, a mental disease, schizophrenic patient will be observed. But it is due to the deficiency of some vitamins or minerals that can be supplied, and symptoms can be subsided. So that kind of that stage of alcoholism, that stage of substance abuse can be managed support of modern medicine. Right? And addictions or craving or this stage can be very effectively managed with the medication, because psychotherapy, Sattva Chikitsa is mentioned very clearly in Ayurveda. De-addiction therapy, that Methya Aushadha Prayoga is very effective in this stage, especially Brahmi. Brahmi is effective in relieving the craving. Brahmi, if you use properly, craving will be subsided. That craving will not be happen. Any form can be used. Brahmi, Churna, Swarasa, Krida, any form can be used depending on the person. And rehabilitation, the awareness programs, that is group counseling, group therapies are there, peer group therapies are there. those alcoholics, those are having or addicted or previously users of alcohol, those people are gathered together and we are allowing them to discuss each other. And this will be moderated by a medical person. The discussion will be moderated by medical person, and they will discuss the bad adverse effects and good effects of alcohol. And after discussion, we should lead all these persons, guide all these persons to a withdrawal from alcohol, to the withdrawal of addiction from the alcohol. This kind of group counseling therapies are peer counseling therapies are very effective, and it is one of the famous among this alcohol therapies, Alcoholic Anonymous. Alcoholic Anonymous is a team where they use these principles. Alcoholic Anonymous, all alcoholic persons are gathered or grouped together, and they share their experiences. Those bad experiences of alcohol will be a motivation to some other person to get rid of alcohol. This kind of therapies can be effectively used. All the psychotherapies, psychological technique and psychotherapies are very effective, and it should be very useful. It should be used in the addiction, this stage of alcoholism. In the beginning, intoxication or withdrawal, that will not be much effective, but for addiction, it will be very effective. So psychotherapies are important, de-addiction are there, Methya Prayoga are important, and these type of therapies are very effective. So we can manage depending on the stage. In short, concluding the disease, first thing we have to understand the stage of disease, what are the dominated dosha, what are the stage of disease, which is the stage of samprapti in that patient. Depending upon the dosha, you should decide the treatment. Which is the dominated dosha, you have to decide the treatment. And if you find all these three doshas in an equal condition, you have to go for Kapha Chikitsa, Sthanan Purva Chikitsa. And another thing is, important thing is use of alcohol or use of madhya in Madatya. That is for removing the, neutralizing the charatva. Amlarasa Pradhana Drivya in Madhya is Shrestha among Amlarasa. That Madhya is used to neutralize the chara, and chara will attain the property of Madhura Rasa by mixing with the Amla Rasa or Madhya. And the person, if tired or weak with this therapies and the properties of Madhya, nourish the patient with the Kshira Prayoga. Nourish the patient with Kshira Prayoga. And from the beginning till the end of Chikitsa, Tarpana Prayoga should be maintained. And Rasa dominated, which Rasa, Amla Rasa or Madhura Rasa dominated drugs should be used. And that should be depending on the condition. And after managing this intoxication or the stage of withdrawal, all these things, we have to treat the patient. Sattva avajaya chikitsa should be done, because our sattva person are going depending with Matagari Drivya or this kind of addiction. So sattva should be elevated or uplifted by sattva avajaya chikitsa, psychotherapies, de-addiction therapies, and all. These are the treatment of Madatya. Thank you.